For areas between the teeth, flossing is important to prevent cavities, infected or swollen gum tissue, and permanent white spots on the teeth. The key to flossing is to get the floss under the arch wire. You can do this several ways. Use a floss threader with a length of floss, or you can use a type of floss that has a stiff end to make it easier to place between the teeth. Or if the gum tissue between the teeth is not in the way, you can use plain floss and manipulate it under the arch wire. When using floss, place it under the arch wire and wrap it around the side of one tooth in the form of a C. Move the floss up and down gently, making sure it goes under the gum tissue. Then do the side of the adjacent tooth and remove the floss. Repeat the process between the next two teeth and continue around the arch until you have cleaned the sides of all your teeth. It does take a bit of time, but this way you can prevent dental disease and shorten your treatment time. It's well worth the effort. It is sometimes very difficult to floss around in between the teeth with manual floss. The Waterpik Flosser is an automated device that makes flossing easier, especially around brackets and wires. Be sure to read manufacturer's instructions prior to use. Insert the end of the handle into the tip in the cartridge. Make sure the tip is secure before beginning. Place the tip below the arch wire and gently move into the space between the teeth. Turn the unit on by pressing down the button on the top of the handle and move the tip up and down along the side of each tooth. When you take your finger off the button, the unit automatically stops. You may keep the flosser on or stop and start as needed. Place the used tip in the keyhole at the top of the cartridge and slide until it is removed. A new tip is used each time you floss.